It's spinning. There
Okay.
you go.
Yeah. Hey, what's up? This is Flex Wheeler with another edition of Flex for Life. My two co-hosts, Greg and LaQuinton. Today, we have a special guest from FIT9, Katelyn. Katelyn, how are you doing?
I'm good. Thanks for having me.
Good. And we're going to be discussing today Therapeutic Plasma Exchange. So, first of all, kind of just give us a background on your inner workings with this.
Yeah, for sure. So I'm Katelyn. I am a registered nurse. I live here in Atlanta, Georgia. I have been a critical care trained nurse for the last 15 years. After COVID, I kind of saw that there was probably had to be a little bit more than what healthcare was giving me and what I was giving my patients. And I kind of flipped into searching for this, wellness space. I had a really good friend who worked as a nurse practitioner at a little clinic in Atlanta, Georgia called FIT9. And I was curious. And so I jumped over, left the hospital. Quite frankly, I haven't looked back. So here at FIT9 Wellness, we focus on regenerative cellular health with peptides, regenerative treatments such as Therapeutic Plasma Exchange, such as EBU. We're more of a proactive state of healthcare than the traditional reactive whiplash, band-aids on bullet holes kind of thing that we see in Western medicine.
So Therapeutic Plasma Exchange, if you can give us just a little background on how it started, what it does, and what are the benefits?
Yeah, definitely. So Therapeutic Plasma Exchange is actually a treatment that's been around for a very long time that is now just kind of getting this notion in the wellness community. So plasma exchange, plex, apheresis, plasmapheresis, there's a bunch of different synonyms that are kind of the same but mean a little bit different things. But what it is separating the whole blood from the plasma. So the plasma is the lightest part of the whole blood, away from your red blood cells, white blood cells, platelets, etc. The plasma is the lightest portion of that. There's a lot of good stuff in plasma, growth factors, protein, clotting factors, but unfortunately, just as the way that we live our life with oxidative stress from environmental factors or stressors that are from our lifestyle or our lack of sleep or our diets, there's a lot of bad stuff that in the plasma as well. So think dead cells, so senescent cells, inflammatory markers, proteins, antibodies, a lot of bad stuff as 30, 40, 50 years of age has hanging out in the plasma. This is the way to really get your, quote, oil change in your body. So from my world, before I came into this wellness space, I was used to seeing plasma exchange in the ICU as a Hail Mary, right? So I've got a patient in the ICU who is sick as a dog because their autoimmune system is inflamed. They have Wagner's disease, they have Guillain-Barré, they've got myasthenia gravis. All of these are autoimmune disorders that the body is attacking itself. So the idea is that when you do plasma exchange, you're doing it in the ICU, you're doing it every other day, you're doing it 5 days in a row to get your body to calm down. So you want to just quiet those autoimmune markers in the ICU. Fast forward to 2025, here we are, and we're kind of looking at this as an anti-aging. We're kind of redefining what's possible, right, in this wellness space, anti-aging performance. We're able to treat the whole blood system. We're taking out the plasma, the bad stuff, replacing it with albumin, which is a space holder, while your body regenerates that new plasma without all of the bad stuff.
Wow. Sounds like you're very educated on all that. Wow.
We try to.
So what are some of the benefits that you can get from the plasma exchange?
Yeah, it's crazy, right? Like, hey, I don't need to go to the hospital to get a plasma exchange. Why would I do this? So basically, we're going to perform a deep detoxification. What we're going to do is remove all of those harmful inflammatory proteins like your cytokines, the metabolic waste, the mycotoxins, mold, anything that is disrupting a healthy environment that is your body. We're going to revamp it, get rid of it, and give you new while your body regenerates the fresh. Your body is smart, right? So it knows how to make the new fresh plasma that doesn't have the harmful toxins that you've acquired over the last decade, 2 decades, 3 decades. We're going to revitalize your body by improving oxygenation, the way that your body, your circulatory system, and the way that you deliver nutrients. So we're increasing mental sharpness, focus. The really cool thing about this in the wellness space is that there's a lot of cool studies coming out about therapeutic plasma exchange and neurodegenerative disorders. So they're seeing a decrease in Parkinson's, Alzheimer's, dementia. They're taking down the inflammation that's in the brain that's triggering those diseases and seeing a decrease in that patient population.
So what is the timeline of how long one of these processes take?
Yeah, so it kind of depends on vascular. So what I do, I've got my plasma exchange here behind me. I do 2 IVs, so one in the right arm, one in the left arm. Depending on how well that flow is, it can be anywhere from an hour and a half to a 3-hour long treatment. I'm constantly monitoring what the intake flow is, what the outflow is, what is your albumin going back in. So it's a little bit different for everybody, definitely vessel dependent. And, typically we're seeing people do this at least once a year, if not twice. If there is something that we are trying to really chip away at that's more than just proactive anti-aging overall health, if we are trying to battle Lyme disease or mold toxicity, then we may be a little bit more aggressive with the protocol, but we work with a nurse practitioner as well as our doctor here to kind of figure out what's best for you. So really cool thing about our clinic is we are all critically care trained. So our MD is a pulmonologist, critical care doctor. Again, I've got 15 years of critical care. Erin, our nurse practitioner, is ICU trained, and we've got another nurse practitioner who is ICU. So we really know what to look for, how to help, how to stick, all of the things that you look for. So that's when you come into the clinic, you're looking at 1 to 4 hours.
1 to 4 hours. And do you guys typically do a blood test or something like that to
Yeah.
get how much plasma you're going to be able to pull out, and how are you able to make that determination?
Yeah, absolutely. So again, this machine, if I could show you guys the inside of it, it's so cool. The motherboard is just huge. It's way smarter than, I'm going to say me, because I don't know y'all's brain, but it's way smarter than me. And if I tell it, hey, I've got Flex coming in, he's a male, he's this tall, he weighs this much, and I tell it what your hematocrit is. So the hematocrit, if you are, say, 52% hematocrit, I know that you are 48% plasma. So based on all of those parameters that we plug in here, it's going to know to do a therapeutic plasma exchange to pull out 2,100 mLs of plasma and return with 2 liters of albumin. So it's very specific. It's very individualized to the patient. And that blood draw is typically done within a week before we do the actual treatment. Now, we do have clients that are coming in and wanting to test other markers. So they're looking at their lipid profile or their mold exposure and numbers within the mold community there. So we can test a couple of different things, but the one that I absolutely have to have pre-treatment within a week is that hematocrit. So I know how much plasma I am pulling out of you.
So speaking of me, I had the opportunity of flying down and having my blood pulled a week before and coming down, and we had as I kind of warned you guys, because I'm a kidney transplant patient and I've had a lot of hospitalization, a lot of blood drawn and stuff like that, that I'm a very, very difficult stick. So it wasn't able to work for me just due to my veins. I know we tried 3 different times, and then we actually tried an ultrasound 3 different times.
Yeah, I told Flex that I got served a big piece of humble pie. I credit myself to being an excellent stick, and I remember talking on the phone, I was like, Flex, I got you. Even if I don't got you, I have the ultrasound, and we will find veins. We're going to get this done for you. And again, humble pie, but it just doesn't work for everyone. If you don't have 2 really good vessels that I can have blood flow out and then return to in the centrifuge, then it's not going to be it's not going to work. But I think the cool thing about being in the wellness space that we are in is that it's not a one-stop shop, right? So you're not coming here just for therapeutic plasma exchange. We can develop a protocol based on recovery modalities or different protocols that we specialize in to help you feel your best self and to help repair you at the cellular level, which is something that's it feels so advanced and sci-fi, but we're smart now, right? It's 2025. We should be able to use the science-backed therapies, protocols, recovery modalities that aren't just medicine.
Yeah, I know my host Greg have a question for you, but
Yeah.
I just want to say it's not on you guys. As I explained to you once I got there, that it's been an ongoing problem in the hospital, even just with IVs that would only last like a day or two. And eventually, after being there about 3 days, they'd actually have to do a central line on me. So, I lost sleep over it. I couldn't sleep because I was so concerned and worried about it. And I'm really disappointed because of all the tremendous benefits, especially me being a kidney transplant patient and the stress that I've had with all my surgeries. I was really looking forward to the benefits of it, but we'll figure it out a different way.
Totally.
So I had a question. It's a little bit of a two-part one, but it will cover a lot of people around the country and the world, really. So doing my research on this, looking at some studies, I saw some studies where they use TPE for COVID therapy, post-COVID. Like just for myself personally, I got it in 2020 and I had long COVID issues for about 6 months after. And then also you just brought up lipid profiles. I didn't find any studies on that one, but are you guys able to do some situation with someone, let's say, has a unfavorable lipid profile and actually be able to affect that?
Yeah, so we'll kind of answer your two-part. Yeah, this is great for long haul spike proteins, anything that we're seeing post-COVID, whether it's vaccine, COVID, et cetera, related. Like I said, it's going to kick out those inflammatory proteins, inflammatory molecules, anything, the bad cells that are floating around in the plasma. What this does, and I guess I didn't really do a good job explaining in the beginning, but as the blood comes out, it's fed through this machine, and right down here is a very large centrifuge. So what that is basically when you go and get your labs drawn from a phlebotomist at a LabCorp, they take your blood out, they've got the sample, they place it in a centrifuge, which is just a really high spinning device that separates the plasma from the whole blood. So that machine is doing this. Usually this is a whole, you've got saline, you've got citrate to make sure it doesn't clot, you've got your blood products, you've got your plasma that's coming out, and then your whole blood that's coming to you. So the machine is constantly spinning and separating those two. So the whole blood and then your plasma that's being, taken out and then replaced back on this side with the albumin, which is the space holder, with your whole blood. So it both looks the same coming out and going in. We're just taking out the bad stuff. You would see it over here and then putting it back in. Secondly, we're garnishing kind of our lookbook, right? So I don't want to say that we're pioneers in this space because we're not the only ones that are doing it, but we're in a really unique position to be able to get our own studies, right? So we're able to look at lipid panels, look at kidney numbers. We're looking at inflammatory markers, so SED rate, CRP, uric acid, anything that can kind of cause some inflammation in the body. We're doing a little bit of work on our end to make our own kind of, like I said, lookbook to say, hey, this is improving you, or this is, a marker that isn't working. We've partnered with a mold company that's doing mold testing, and we're seeing significant decreases in some of those markers, which the mold company was kind of blown away that those numbers were going down. So they were excited to use us as kind of their, I don't want to say guinea pig, but their guinea pig, right? Like we're doing this in a space that is fresh and new and exciting, and we're all kind of doing it together to get the best outcomes for our patients in a proactive manner.
Could you elaborate? I've heard you mention mold several times.
Yeah.
It kind of bothers me that the thought of having mold. First thing I think about is a house, and a house with mold in it doesn't fare so well for those people in limits. Can you elaborate on just so we can conceptualize, you were saying mold. I see little green stuff on the wall.
Yeah. Yeah. So mold is a huge toxin that can affect the bodies. We probably all to some extent have been exposed to mold somewhere in our life, somehow, somewhere. We may be living in it, maybe in our car, and we're exposed every time the air ventilation comes on. Or we got exposure when we renovated the beach house that we bought 10 years ago. You know, everybody has a different scenario, but mold is a huge toxin that our body wears as a big burden that can kick off other pathways, inflammatory molecules that allows our body not to have the best environment where it can take care of itself and get itself better. So there's a lot of highly specific and highly specialized mold tests that we can see. And the only thing that our clients are doing on our end different is the Therapeutic Plasma Exchange. You know, it's hard because in this space, so many people are using their mental resources, their financial resources to try to get some type of symptom relief, control, etc. And by the time they come, like, you guys, I'm exhausted. I cannot take this on any longer. And we devise a protocol. Okay, let's look at your numbers, whether that's mold, inflammatory markers. What are your micronutrients doing? What is your thyroid really doing? I know that this is getting a little bit off subject of Therapeutic Plasma Exchange, but wellness is so much bigger than the standard labs that we're getting at our annual physical. And like for me, so I was a young woman back before I started here at FIT9 Wellness, and my OB was my primary care, just because it's like, I'm young. I don't need to go to the doctor because I don't have any ailments, but I've also spent 35 years of not looking to check in to see what my labs looked like. I'm a huge believer that knowledge is power and data is knowledge. So if we can combine all of this and know more about ourselves, then again, wellness is a huge encompassing space that I am super grateful to kind of be on the forefront of pioneering these alternative therapies that aren't just hope not to see you in the ER or the ICU when you're 50, 60, 70, 80, and telling me, you know, Katelyn, if I'd have known 20 years ago that this was starting to creep up or this was starting to decline, I would have done something different. So it's a way for our clients to be able to be an advocate for themselves, their health, and their wellness, which I think is just priceless.
Okay, I want you to remember two words. Come back to them: thyroid and inflammation.
Yeah.
Okay. So number one, is there a benefit, or what benefits you would say for a professional bodybuilder or a professional athlete? What would benefit them to go through this process, or even begin to research the benefits of this process?
Totally. Inflammation is the takeaway that you need to take away. The word inflammation is the biggest cause of diseases. Diabetes, Alzheimer's, cardiovascular diseases, events, etc., is all driven by inflammation that's within the body. If we can chip away at that, decrease the inflammation that's been put on our body from being a professional bodybuilder, professional athlete, somebody that's had a high stress job for the last 30, 40 years, that puts stress on the body. You know, somebody that is as a product of our food and our water and our lifestyle, that is driven by inflammation. And the way that we can do that doesn't have to be the Mac Daddy, right? It's like, it doesn't have to go straight to Therapeutic Plasma Exchange. There's so many levels of this, but this guy really is the pinnacle of anti-aging. And Flex, we talked about it. Again, it's not okay, you get a plasma exchange, you get a plasma exchange. It's something that you really should talk to a provider about and say, hey, is the best thing for me? Because there may be some other things to try before it's like, let's do the plasma exchange. But it's something that we feel very strongly about in this space, in the wellness community, of being able to offer to our clients, whether they're young, old, super athletic, high endurance, or super. I've got someone that, you know, has mold exposure or Lyme disease. It's like, these are things that I don't want to say that they're looked at as woo-woo in Western medicine, but it's kind of like we just put them in a corner and like, they're kind of crazy, right? Like, Their symptoms are kind of in their head. We can't really figure out what's going on. Do you need an antidepressant? It's like, okay, hold on. Let's not just, again, for my lack of better term, put a Band-Aid on a bullet hole. Let's really get down to the root cause. And I think that that's what's so alluring about being in the wellness space. I love critical care. Critical care will always be my number one boyfriend. I will always love Western medicine, thrill of the sick patient, but I have made so many more connections with clients that want to better themselves in this space versus my ICU tenure. I helped people. I loved ICU. I will never regret that, but I'm so grateful to be in an environment such as the wellness space.
So I specialize in working with the aging population, particularly the seniors. Okay. The second part of my question, think thyroid, inflammation, food. Thyroid, inflammation, food. So our clients, they're constantly talking about something is wrong with their thyroid. They're constantly talking about inflammation. I understand that right now this procedure is not necessarily covered by insurance, but speak specifically to an aging population, say 60 plus, that's dealing with inflammation, that's dealing with thyroid issues, and how did it all play together? Particularly to call out some foods that can they create some situations.
Yeah, I mean, when you think about thyroid, again, this goes back to you go to your physical once a year, once every 5 years. I don't know how often or not often people don't go, but what they're normally checking is a TSH, so your thyroid stimulating hormone. They're like, oh, it looks good. The reference interval for a thyroid stimulating hormone is 0.45 to 4.5. So you're telling me that in that big span that this person over here at the high end and this person over here at the low end feel the exact same. I'm just not a believer in the reference interval as a one size fits all. And there's more things to explore with that. So when you think of Hashimoto's, for example, which is the autoimmune process that the thyroid undergoes. So thyroiditis, Hashimoto's, there's inflammation attacking the body, right, as a basis of the thyroid. So really big markers for that, you're thinking gluten, you're thinking soy, you're thinking alcohol, you're thinking dairy. All of those can be triggers for that. So that's my caveat with thyroid inflammation. We've got a whole different protocol that we can tease apart with thyroid, with recovery modalities, peptides, etc. The aging population, I think, again, the number one takeaway is inflammation. So as your body ages, the inflammation also grows. So you get this inflammaging effect, right? So you've got high inflammation as you age. The Therapeutic Plasma Exchange, you're not going to do one and be done. But it's something that you can really do to help your body work better for itself. Again, back to the car analogy. Is my car going to run if I've got dirty oil? And again, this is coming from a girl who is from East Tennessee. I've never changed a tire or changed my oil, but I know that I need to do it, right? Because my dad said I have to. So this is kind of that way, right? It's like, is your body going to age? Yes. But can we help it age more gracefully and let our body work better for it?
You there?
We lost audio.
We lost the audio on you. Yeah.
Can you text her? Can you text her? Greg, hit pause on the recording. Okay, Greg, you can start it back.
Yeah, so just going back on all that, I know Q has a specific client base that he likes to ask questions for.
Yeah.
I'm thinking big picture. In my research, I saw, in the age demographic of 45 to 65-ish, the average person has a unique prescription list of 4.7 different medications. And I don't care what side of the aisle, and I'm not a pharmaceutical guy, but there is no safe drug. There's always some kind of side effect. So can you speak to the benefits that TPE would have? Because obviously it's in your system, it's going to be in there for a while. Can this help with some of those, the stuff? There's always side effects, right? So can it help with that situation?
Totally. So again, I agree with you, right? Like, again, I don't want to keep beating a dead horse, but Band-Aids over bullet holes, right? So medication. You're kind of crazy. Here's an antidepressant. It's like, hold on, let's think about this. So I think the really cool thing about taking control of your own health, being your own advocate, doing your own research, you can help your body age in a way that protects you over the next decades, right? So I'm living now because 100 years isn't going to be enough time with my kiddos, right? I want to be there for every single step along the way. So if I can do anything that's going to help me do that, I want to be signed up for that. Now, if we are doing therapeutic plasma exchange and you are still going and, eating super processed foods, or you are not exercising, if you are still being harmful to your body, it's kind of like this is a drop in the ocean, right? But if this is something that you are really passionate about, making your body work more optimally for you, then this is what we can do. I think that we're still getting to a point where we're looking at studies on the long-term effects of this, which is what we talked about with neurodegenerative disorders. It's really good in the Parkinson's community, dementia, Alzheimer's, etc. But also being able to look at decreasing the inflammation. So we're looking at, can we get you to a space where we're taking you off your blood pressure medicine, your thyroid medication? Are we able to get you in a spot where everything in your body kind of stabilizes when you were young? Now, if you were, autoimmune kind of from the get-go, it may be, again, something that we're doing more than just once a year or twice a year. We may have to have a bigger protocol depending on the patient. Again, this isn't a one-size-fits-all. You're going to bring your car to me and I'm going to tell you what oil blend you need, or what something could work for you. So it's cool to be in this space, because there are things in conjunction with alternative therapies that we can let our body do the most work for us.
Oh, I'm going to keep jumping. So I'm looking at the long picture again, and you brought up a lot of stuff with doing this preemptively, right? So not waiting till your car breaks down to do that oil change you keep talking about. So not getting to the point where you absolutely need it. So best case or worst case scenario, however you want to look at it, let's say someone starts looking at this in their 30s, they have kids now, all the stressors with career and life and wanting to get activity in, kids, all their activities, marriage issues, all that kind of stuff. How often, let's say on a yearly basis, would you recommend, if there's no other health issues, but this is just one to remain as, on top of things as possible, would you recommend?
Totally. So I think if we have someone who is coming in to do this as a wellness, longevity, I'm really looking into the anti-aging aspect, I think once a year is good. If you want to treat yourself, it's not going to hurt you to do it twice a year, right? But I think if we're like baseline, once a year is great.
So not it's not a situation where you're like a dialysis patient.
No. I mean, you could do it. I just don't know that the risk of diminished returns would help, right? So I think that you get to a point, if we are not actively battling something that we are working in your body to kind of trigger loose, and we are doing this just for the anti-aging benefits, I think a once time, like let's swap everything out, start fresh, then we like a once a year.
All right. In that respect, could you speak to the overall wellness benefits, but the person who just wants to have their activity levels higher and not, in my case, not develop the dad bod situations, maybe even stave off some issues with overuse as far as, burn the candle both ends because of everything going on, how this would benefit them even once a year.
Totally. And it's hard not to, right? Like we're 2025, we are yes, ma'am, no, ma'am. We are doing everything to help everyone. And I think the thing that gets lost is we forget about number one, and that's us, right? Without our health, we have nothing. So I think that if we are able to detoxify our body, improve our immune function, improve our cellular health, which again sounds crazy, but scientifically have backed regenerating the cell, right? So we're improving the oxygenation, we're improving the circulation, helping the brain, anything that keeps inflammation out of this guy. Because again, I could be a shell of a body, but I don't want to live that way, right? It's like, I want to protect my brain and my heart at all costs. And this is something that can help, again, be proactive for the years to come. So we can look at decades you're determining now what your decades look like in the future. So as your kids are, graduating from high school, going off to college, they're getting married, having their own kids, you're able to not put that burden on them because you've got a list of medications or a list of diseases this long because of the inflammation that we've taken on.
Got it. And I'm sorry, guys, one more. And I know this is broaching a little bit of a touchy topic, but the industry in general, the fitness side where I come from, and also the social media side, the topic of performance enhancement drugs is becoming a lot less taboo, to the point where you're seeing 19 and 20-year-olds jumping on black market substances to look better, and that's to get more clicks, all that kind of stuff.
Sure.
One of the side effects of a lot of these drugs is viscosity of the blood. And then there's some people just have situations like that in general. I know Flex has to be on medications for that as well. Can that help with those situations, alleviating that particular symptom?
Yeah, I mean, I don't know if there's a specific study out there that says, yes, therapeutic plasma exchange is going to be perfect for this. But scientifically, if we think of shooting out the plasma where all of those inflammatory molecules, antibodies, dead cells hang out, it cannot hurt it. Now, again, it's scary, right? The internet is a broad, scary, big place. And I think about my kiddos one day, like getting on the internet, and I'm like, how do I save them? We just got to be conscious of what you're putting in your body. Your body, again, is the only one you got. And I can't do anything with that if it's broken.
Thank you.
Understood. So, I mean, it's even more disappointing just hearing you talk about the various different benefits, and I can just completely see in every category how it would have helped me. So that's very disappointing. But how much would an actual process cost? So you said like once a year would be a good starting point. So what are the costs to this?
Yep. So here at our clinic, we are $5,000 for our single session treatment. Depending on if you're a person who needs a greater protocol, we could do more treatments. And of course, we could offer some discounts there. We know that it's expensive, but there's a lot that goes into this. Again, you've got a critical care trained staff. Albumin is expensive. The kit is a single use kit. So I'm not going to use, a Flex's kit for the next person that comes in. It's a one-stop sterile closed circuit system. So nothing is touching anybody else's blood or the actual machine. Everything is a sterile kit, one-time use. Like I said, that's $5,000 per treatment. And I think that's pretty comparable to what the wellness space has going on right now.
So your albumin, where do you get your source from? Is it all from here in the United States?
Yeah, we source our albumin from pharmaceutical companies.
Okay. And when you talk about $5,000, when you I say that all the time. People, they'll take care of their cars, they'll take care of their hair, their nails, their clothes, their 401k, their investments. But if you don't take care of the person who makes that happen, then, where are you right now? And so when you talk about how much we just spend on a monthly basis on various other things, I mean, even something like Starbucks, how often we go there, when you look at $5,000, when this can actually, put years onto your life, that's not a large expense whatsoever. If you could just give us like your website, your Facebook, or your Instagram on where people can contact you guys to get more information or set up an appointment.
Yeah, totally. We've got people actually, flying in to come do this for us. So it's an exciting space to be. I'm passionate about it. My team is passionate about it. You can visit us at FIT9, FIT9ATL.com. Like I said, I'm Katelyn, the registered nurse here. We've got Aaron as our nurse practitioner. I am the @regenerative RN, and Aaron is at the peptide practitioner. So we've got a wealth of information about the treatment services that we offer. Again, we are very big in knowing that the foundation of health is nutrition and movement, but there is so much that also goes into the body. that we can offer. So Flex, I know that we weren't able to get the plasma exchange up and running for you, but know that you are always welcome here to use any and everything. You've got a direct line to me, a direct line to Aaron. We want to see you succeed. We love your energy. We love your personality. We just love you. So anything that we can do, we're here for you.
Well, just
I appreciate it.
Really quick, Katelyn, this is one of the therapies that you guys offer. If you just go to a quick bullet list of some of the other things you brought up, peptides, that's just another one of the things you offer.
Yeah, totally. So peptides are kind of our bread and butter there. Like that is our chef's kiss. We've got that down. And then we started to say, okay, well, we can add more to this, right? What other alternative therapies can we do? So I love an IV cocktail. I love an IV therapy. You came in pre-vacation, post-vacation, post-sickness. You just need a downtime. I love IV therapy. I do all sorts of lab work. Again, data is knowledge, knowledge is power, all of that. I want to do lab work at least 3 times a year just to get a pulse check. We look at hormones, we look at all of your organ systems, micronutrients, lipid panels, all the things, and make a protocol based on what your wishes are for your wellness journey, as well as how can we improve some of these lab markers. We do EBOO, which is extracorporeal blood oxygenation and ozonation, which is a whole nother kit and caboodle there for you guys to study. But EBOO is kind of therapeutic plasma exchange light. The blood is coming out. I'm hitting it with ozone and UV light to act as the antimicrobial, and then putting that back into your system with an uptake of oxygen, as well as the ozone therapy to act as an immune modulator. We have a sauna, we have a cold plunge, we have a red light therapy bed, we have a hyperbaric oxygen chamber, we have a full techno gym downstairs, we've got personal trainer. It's a big playground. Again, I'm so grateful to be here and think that we just have one of the best, most beautiful places in Atlanta, if not the Southeast. So I'm very proud of what we do. I'm very proud of our communication and the way that we talk to our patients, the way that we develop relationships. So again, FIT9 ATL, we've got you covered.
All right.
So Katelyn, I just want to thank you so much. Just meeting your entire staff, Jeff, the owner, also Aaron, and even Jessica, you guys lead fitness expert trainer. I know how busy you guys are because I was just astonished of seeing how many people were walking in and out the door. So thank you so much for taking this time out and explaining this. I'm as everybody is aware with all my health issues that I have, I'm very much on, believe in the cutting edge of new technology and everything. So, very disappointed that I couldn't get this done, but we'll look at doing some other things in the future.
Yeah, absolutely. It's been a pleasure, if not an honor, to be a part of even a small bit of your recovery, your health, all of it. We're happy to have you in Atlanta anytime.
Thank you so much. So there's another episode of Flex Wheeler, Flex for Life podcast. Thank you so much. Our special guest, Katelyn, my co-host, Greg, and LaQ. Thank you guys so much. We'll see you next time.